Hello, and thank you everybody for inviting me to speak here today. It's really my true honor to be here, and I represent Baycrest Center for Geriatric Care. Today, I'm going to briefly introduce myself and what I do. I'm going to talk about the needs of family caregivers of older adults. I'm going to share with you a framework for innovation, and then we're going to apply the innovation to practice. So just very briefly about where I work and who I am. I've been working at Baycrest, which is an academic health science center that provides continuum of care for older adults. And we also do our research center. We study brain health and aging. And I've been doing this for over 34 years. I had a master's of social work, and then I went back to do my doctorate and specialized in caregiving, and particularly dementia caregiving is my area of specialization. And at Baycrest, we're very lucky that we get to do research, we provide clinical care, we do innovation all together. A few things about within Baycrest. I lead, it's called the Koschitzky Center for Innovations in Caregiving. And what this is a hub for innovation, and we disseminate best practices in caregiving. And when we talk about caregiving, we're talking about family caregiving. Our mission is to support family caregivers through evidence, innovation, and partnerships with other people. And as I said, we're very lucky because we work at the intersection of care, research, and technology. So let me tell you a little bit first about what are some of the needs of family caregivers of older adults that we know from the literature and from experience. The first thing we know is that cultural background matters, and the way family caregivers behave and experience the caregiving journey is affected by their family traditions, some cultural filial piety. So this idea that it is our duty to look after our parents, we don't have a choice, is very important. And so in cultures where we feel it's our duty to look after our elders, we're compelled to do this. In other cultures, like in North America, it isn't the same thing. There's a lot of adult children who don't necessarily feel compelled to look after their parents, and that would have an impact into how you provide support. Also, whether you live in a multi-generational home, so that's homes where you have children, parents, grandparents living together, affects. There's more bodies, the dynamics are different. Also, if culturally there's very specific gender rules, where if you're a woman, you're expected to provide the care, and if you're a man, you're supposed to go work. So depending where you live, if you have some of these cultural norms, the experience would look different. And also in cultures where more collectivist cultures, meaning cultures where community comes first, you are more likely to have support, as opposed to, say, North America, which is more of an individualistic culture where everybody looks after themselves. And so there's less opportunity for networks of supports for people. It also matters whether you live in an urban setting or a rural setting. In urban settings, there's more supports, more services generally than if you're isolated in a rural area. And then there's geographical differences based on where you live. You could be in an area where transportation is very hard to get to. And so that would make a difference into your experience as a caregiver. Then there's individual factors that affect caregiving: your level of education, your income, the type of relationship. So are you looking after a parent, or are you looking after a spouse? and you're an elderly person yourself, you're 80 years old looking after a spouse who's 80 years old, and the quality of the relationship as well. So if I had a father who was very abusive when I was growing up, that the experience will be different than if I had a loving, close relationship with that parent. Also, the stage of life. If I'm a caregiver and I'm in my 40s, is different than if I'm a caregiver and I'm in my 70s. And with people living longer, it's not unusual to have a 70-year-old looking after a parent in their 90s. And so we have a whole set of older adults looking after older adults. And that generally impacts health, because the older people are, the more likely that they'll have geriatric syndromes and illnesses. The support network, as I said, if you have siblings, if you live in a community that helps out, your experience will be different. Whether you're working, your work demands, and you work a busy job, you may not have too much time left over. Also, whether you have access to technology and you're comfortable with the technology, that makes a difference. If there are language barriers, if you live in an area and wherever you live, that's not your first language, you may have difficulties understanding and availing yourself of resources from the government or agencies. Also, the stage of illness. Caregivers go through different experiences at the time of initial diagnosis versus later stages. The kind of help you need initially is more emotional. Coming to terms, say, with the fact that your parent has Alzheimer's disease is different than in the later stages when your parent is bedridden and you need to provide physical care and support. And so also your confidence and knowledge about the illness and about your ability to provide care matters. The other thing is, as I said, is the trajectory. So say you're looking after your parent and they had a stroke. Was it sudden and your parent was working and physically active, had a stroke, and all of a sudden is bedridden? Or was it something like Alzheimer's disease, which is gradual over 5 years before you realize there was a problem? Your adjustment to new routines every time. Also, we know that the longer you are a caregiver, the harder it is and the more stress and burnout people experience. So if this is just 1 year versus 20 years of being a caregiver, matters to reduce stress. And the other time that is difficult for caregivers is those points of transition. So for example, if your parent were to go to the hospital, to a long-term care facility or nursing home, those points are points of crisis for families. And so family caregivers experience social isolation. There is stigma for a lot of people. There's still a lot of stigma depending on the condition your parent or your spouse or whoever has. Dementia has stigma associated to it. People are not prepared. Nobody teaches us in school how to be a family caregiver and look after somebody. Sometimes there's no resources. Financially, it's expensive to be a caregiver. There's emotional, physical strain. Sometimes when you're working, your employer is not flexible to give you time to look after the person you're looking after. And sometimes there's cultural and language barriers. And that's particularly true in a place like Toronto, in Canada, where we have such a diversity of cultures living here. I don't know if this is the same for you, but in North America, one of the biggest problems we have is we have services, but it's impossible to navigate them. People have a really hard time figuring out what kind of service they need when they need it. And so the literature research shows that what caregivers need is education about the illness they're dealing with. They need emotional support. It's not just giving resources to people. Caregiving comes There's a lot of guilt that people feel. There's anger that people feel. There's denial, not coming to terms with the fact that the person you care for has a terminal illness, and dementia is considered terminal, or cancer, or whatever that may be. Then having the social supports, as I said, we need to give caregivers those resources, the skills to manage the illness. So if you need to feed somebody, you need to learn how to feed so that somebody doesn't choke. That's a skill that somebody has to teach you. You need to learn how to navigate the system, and a lot of the times financial support. So some of the things we know that helps families cope better is having support from others. Sometimes it's emotional. It's finding meaning and purpose in caregiving, finding that there's a reason higher than themselves why they're doing this. And, this idea, my parent was so good to me, looked after me. Now it's my turn to return that favor. And so I'm doing it with my heart. And that comes together. People with spiritual beliefs and faith generally have an easier time with it. The cultural beliefs, traditions, the opportunities to learn. People need supportive policies and advocacy. Government support is crucial. And here where we come to this conference is this idea of we need helpful technologies. And so for today's presentation, we'll talk a little bit about later on about how a tool, an app that we develop, CCART, can help navigate the process. And what I'm going to do with you is explain to you a framework for innovation and then give you examples of how we've done it at the Koschitzky Center at Baycrest. The thing it's important to understand is that caregivers need the right intervention at the right time for the right caregiver. You can't just throw things at people and expect that it's going to work for them all the time. And that sweet spot where we're giving the right thing for the right person at the right time is what we're always targeting. And so how do we target the sweet spot? Through innovation. Why do we need to innovate? Is because, like we all know, we have global aging population is rising, and it's rising by a lot. And this is not going to go away. And right now, in most countries, in North America anyway, we have more people over 65 than under 15. And so these trends are going to continue. And so the way families have been looking, families are the backbone of our healthcare system here. And we can't keep relying on them without supporting them appropriately. It's unsustainable. We also, the older people get and live longer, there's a rising in prevalence of dementia and complex care needs. There's an increase with that of caregiver burden, emotional, financial, and physical. I don't know if you know that caregivers, whether they're spouses or adult children of people living with dementia, are 6 times more likely to develop dementia themselves. And that is not because dementia is contagious. That's because of the stresses associated with it. So it's really important that we support these families. And why technology matters is because through technology, we can scale, we can make it more accessible, and we can personalize the care. So I'll share with you the innovation framework we use with caregivers. So whatever idea we come up with, we always co-design and work with caregivers, with clinicians, and researchers are part of our team. I never work in isolation. When I have an idea, I call family caregivers and run focus groups and say, what does this sound to you? Is this something you think would be helpful to you? I bring together my colleagues who are clinicians who are providing care at the bedside, who tell me these are some of the issues that we see. And I partner with researchers as well, so that we can evaluate what it is that we're doing. And then we pilot something, but it's in an iterative development. We develop a product, and most viable product first, our first testing, and we test it and we keep improving it. And we always partner with tech developers, with funders, because without money we can't do anything, and with community organizations. And so as part of my team, I work with project managers, I work with systems engineers, I work with social workers, I work with physicians. And that is really important, because bringing different perspectives to the table is what enriches what we do. And the thing that I want to make very clear is that innovation uses technology as a means to an end, but it doesn't mean that every innovation is guided. It's guided by the principle of what are we doing to support caregivers. Technology could improve it, but it's not just any innovation that we'll do will have to be technologically appropriate or use technology. I mean, that's not the point. And in case you haven't heard, the first law of technology is neither good nor bad, nor is it neutral. And this is important to remember, especially as we move into the world of AI. And I'll give you some examples of the projects, innovations we've done at Baycrest in the Koschitzky Center, just to show you the breadth of things that we can develop, not all of them using technology. And so that you could see some here, for example, where we see the couple spinning, and that's in the bicycles. We developed a program for younger people with dementia. So those are people that develop dementia under the age of 65. And it's a hard group to target because the spouses are generally in the workforce. They're too young to benefit from services that are given to the over 65 group. They're still fit and healthy in other ways. So we form groups that people meet an hour a week, and they go spinning, the spouse and the person with dementia, and they have music. So because of the age group, they're listening to the Rolling Stones and to the Beatles, because this is the kind of music this age group likes. And then they have a social worker at the end, coffee and cookies. Food goes a long way when we're supporting caregivers. And this does not use technology. However, we could use technology to innovate and show it then virtually. The problem is, what we like about this is that people are together, they're social. But if we didn't have that ability, there's no reason why we couldn't virtualize this program and test it, just like we used to do with our support groups, where we had them face-to-face. COVID hit, we moved virtually, we evaluated, and we found we had very similar outcomes. Other things we've developed, CCAN tool is when family members place the relative into a nursing home, a long-term care facility, it's a period of crisis. So it's understanding how do we help them and what do they need, because they fall through the crack, these groups. Then we partner where you see the virtual reality glasses with other Toronto hospitals through the Toronto Dementia Research Alliance. And we're doing research around using virtual reality to train family caregivers around responsive behaviors of dementia. We'll tell you how that goes. We're in the midst of it. Here, we've developed clips to support a program, younger carers. So those are people 20 to 30 years old. They also fall through the cracks because they may have parents with dementia, but they're in a stage of life where they should be launching their lives, going to university, moving out, and instead they're home looking after parents or grandparents, and their needs are very different. We're also developing here an AI chatbot to support families understand how to prevent responsive behaviors. If you go on our website, you'll also see over 45 videos on different topics related to dementia caregiving. We also have e-module learnings on what it is to be a caregiver, how to engage, how to ask for help. Because one thing is very hard for family caregivers is how do they ask for help? And finally, CCART, which I'll spend a little bit more time on, so I'll explain it later. But what all these things, all these projects have in common is the pathway to innovation. So the first thing we do is identify what's the gap in the caregiver support. So for spinning, for the younger onset, we had a gap that there was nothing for the 50-year-olds that had dementia and their partners, nothing that included physical activity that we know is really important to support those people with dementia and their caregivers. And then we engage the families themselves and different stakeholders in co-designing and saying, would this make sense to you? Do you think this is a program that you'd like? Help us understand some of the barriers you would have. And we develop a prototype with pilot, we evaluate it, we refine it, and then we scale it if it works and if it's good, because we've had some projects we've done that are not particularly great. And those we said it was nice doing it, but I don't think we want to scale them up, because part of innovation is you got to try and fail. And by fail, I don't necessarily mean that it doesn't work necessarily, but that the impact is not as strong as something else, so that you have to decide where are you going to put your efforts. And again, when we're applying innovation to practice, you have an idea, an innovation, you test it, you evaluate it, and then you ask the people again, and you go back and forth. This is the iterative process until you're able to have the best possible product that you have. And I want you to not think that you must have the best product right away, because it never happens that way. You got to be able to live with good enough. Good enough is good enough sometimes. And what's really important to understand also is that we embed research in all of the innovations and products that we develop. And the evaluation starts at the beginning. So the partners that help us with evaluation at Baycrest, we bring them to the table when we're thinking of ideas, because they're the ones that are going to tell us, make sure you do this, because we're going to want to measure, for example, quality of life for caregivers. And our outcomes, we generally try to have qualitative and quantitative outcomes, and we try to publish and do knowledge translation activities. For example, now me speaking to you is part of our knowledge translation activities. We do things and we share with others, with the world. Let me talk a little bit about some of the barriers and enablers of this is access. So with family caregivers of older adults, sometimes there's no access. In Canada, not everybody has access to internet and to technology. It's very expensive here still. Some people don't have the digital literacy, and it's hard to learn, and we don't have necessarily the supports to teach. I mean, I always joke, I see it with my parents. It's my son that's always going to their place to restart the computer. My mother will call my son and say, I don't know what happened, Ben. Everything's disappeared. I don't know what I pressed. So people need to be able to have access to support, not just the internet, not just the equipment, but when things go wrong, who do you call? And projects have to be sustainable. So I'll talk about it. We develop an app, but you have to think long term. It costs money to keep an app up and running. And so who's going to pay for that? And the enablers to this is we need partnerships with other organizations, with the government, with donors and philanthropy. You just need to make sure that you're not working in a vacuum. And you need to train others on doing this stuff. And the way we tackle barriers is when we design things, we include everybody. We include the patients even, not just the family members. And we constantly think about our systems thinking. So if we're going to have an election and there's going to be a change in government, we're already thinking, are they going to be supportive of what we're doing? Is this going to be a priority for this government? So I wear different hats. I'm on 2 different boards of directors. One is the Ontario Caregiver Coalition, where we do advocacy in the province of Ontario, which is where Toronto is located. We advocate for the government for supports for family caregivers, because to me, that's an important hat to wear. And I'm also on the board of directors of the Petro-Canada Caremakers Foundation, who supports family caregivers. And we fund different projects related to caregiving, because I truly believe that we can't just work at the micro little level. We need to work to support caregivers at every level. And so, as I said, we partner with different foundations and groups. RBC Wealth Management is a bank, a private bank, but they support the work that we do to better the lives of family caregivers. So Alzheimer's societies, different national funding agencies and charities. And I don't know, and maybe for you it's different, but I think most people I speak to in this field, no matter where they live in the world, money is an issue to try to come up with resources to support families. So I'm gonna now, for the last bit of time I have, share with you one of our innovations and walk you through how we came about, how we did it, the process we took. You can, the QR code is there, or you can go to the website. We have it both on apps, on your phone, Google phone, or your Apple phone, also through HTTPS at ccartbaycrest.org. You can find it through a website. But basically, it's really a one-stop online tool to connect caregivers with the right support at the right time. So remember when I talked about finding that sweet spot, that's what we're looking at. So CCART stands for the Canadian Caregiver Assessment and Resource Tool. It's free, it's anonymous, we don't collect any data or keep any data. It's an online tool that helps caregivers identify their needs and connect to local, provincial, and national resources. So it's very Canadian-based, but I want you to understand the process of how it could work for your groups. So it's designed, this is not designed initially just for caregivers of older adults with dementia. It's really for all types of caregivers in all parts of Canada, because a lot of our services are very geographically based in the province, the city that you're from. And so it could be just as useful for a mother of somebody, a son with Down syndrome, living in one part of North Canada, to a daughter with a parent with dementia living in the east coast of Canada. And it works with different cultural backgrounds, gender identities, whether it's end-of-life situations or a particular chronic illness. And it offers tailored evidence-based information to guide caregivers in their journey. And this, it came about out of, it's always, what problem are we trying to solve? And we know that we have a gap in that we have resources in Canada, but it's hard to find the right one where you live, that you currently live. So caregivers told us they needed help with navigation, they wanted relevant information, and they wanted something quick and accessible. And so, like I was saying, we co-designed with caregivers, with providers like healthcare professionals, with researchers. And we found through our focus groups and research, we found that there's 4 common areas of caregiving. One is around emotional and physical health. The other one, caregivers want to know the illness and condition they're dealing with. They need awareness of resources and how to access them. They need to have the confidence and skills to provide the care. Through CCART, caregivers can self-assess their needs at any time. So if you try it, it's a series of about 15 questions. It was hard to get these questions right because there's a lot more information that we would be interested in obtaining from people. But if the information we were asking didn't lead to a different resource, we scratched that question. Because we realized, is it really, really necessary, or is it just interesting for us to know? Caregivers are overwhelmed, and so we don't want to waste their time doing a lot of questions and spending their time becoming overwhelmed, filling out a questionnaire. We want them to be able to do this in a quickly efficient way. If you do it through the app on your phone, the advantage is it's saved on your phone, and it could track changes as circumstances evolve. For example, you have a parent with dementia, you go to the doctor, it's a new diagnosis, things are stable, the person you look after has a fall, a fracture, needs surgery, and then mobility goes down, you start having broken skin conditions, incontinence issues, and before you know it, the care becomes more physical. You have to be able sometimes to use a catheter for a person. So the needs change. And if you use it in your app, the situation, you can keep track of new opportunities of services that could be available to you. The other important thing and helpful about the app is that people become aware of different supports that are available, even if they may not need it now. Just knowing that these things exist, people have told us, is very helpful. And so how did we start? We first of all identified the caregiver needs, as I said. We created targeted questions about mood, physical health, caregiving knowledge, and preparedness to be a caregiver, because these are things that matter. Then we very painstakingly went through all the services for all caregivers in Canada and built a national resource database of every type of condition. And this took a long time. We have a lot of trainees and students that come through our center that supported to build this. But of course, this is hard to maintain. And this is where AI comes in that we can then help it to find broken links, organizations that don't exist anymore, new organizations. It could do that work that it would be really next to impossible for us to maintain and keep the website or the app sustainable. We run focus groups with diverse caregivers. We had parents, spouses, adult children, different conditions, to test and refine the questions. So there's a reason for why we included what we included. And then if you do it, you realize it takes you through questions, and it links you to assessment and to the resources on the website. And then people could keep it saved as a PDF, or they can go to the resources now and see if they said they have financial concerns, it will send them more financial resources. And if they have mood issues or depression, it'll take them to those kinds of resources. So it's it's catered to the needs of that particular assessment. Just so that you know, it's hard, because one of the things we're realizing is caregivers don't want to be bombarded with a lot of information, and finding that sweet spot again between not too much information but sufficient information is hard. The things we had to make sure through this process is that CCART was private and secure, that we don't collect any identifying information. And so we collaborated extensively with the IT department. We had a company that does security, that secures a platform and protects caregiver data. Every time we change code, we have to go for code review. We don't want to be the link, the weak link spot that where there's a problem here. We worked with a designer to ensure the tool is visually engaging and easy to navigate. And what I want you to understand is the version we have now is not the version we had first. It's not the last version we're going to have. We continuously try to improve it, but we have to not do it too fast, because every time we change something, we need to go through code review. It costs us $8,000 to go through code review. It's not cheap. So we have to save changes, you know, and then when we feel, okay, we have a critical number and mass, let's go through code review and upgrade things. So it's that constant balance as we use technology and improvements. There's repercussions. I can't just ask our systems engineer, just change that and that's enough. That's not enough. Then we need all kinds of approvals and testing, and we do pilot studies. We partner with other organizations that represent diverse populations. And then I'm going to tell you the stage we're in now, which is, I have to say, one of the most difficult, is the outreach, getting the app or this resource out there into the hands of those that need it. Doctors, nursing homes, community settings. We need to evaluate it. So if you use it, at the end, if you choose to, you can give us feedback, which is very helpful, but we can't make people give us feedback. So what happens is we rely on the kindness of people to give us feedback to keep improving it. And so we launched the website and the app in November. Actually, the website November 2024, and the mobile app launched April 2025. And as I keep saying to you, it's a work in progress, never finished. Here, I want to acknowledge that we've received funding from the Petro-Canada Caremakers Foundation, the RBC Wealth Management, and the Slate Family Foundation as well. I also teach at the University of Toronto in the Faculty of Social Work program, and we've received funds from the Center for Aging and Brain Health and Innovation as well. We found through our evaluation that the app has a lot of resources, that family caregivers find it helpful. Families sometimes they feel, well, there are no resources for me. I can't do this. And to find out that there are resources is an eye-opener. And we're working on our next generation, which will have specialized versions. So as I said before, it's for all caregivers. We're developing one for dementia-specific caregivers, one for geriatric conditions and mental health, and one on developmental disabilities as well. Through AI, our goal is to make it more conversational in nature, and more chat style and adaptive type of questionnaires, more personalized recommendations. It keeps evolving. Want to make it more accessible through voice input and more intuitive and human-centered design. And again, we keep collaborating with others. So once again, here's the QR code for it and how you get it for you to test it and see it. I'm not going to go through some of the challenges and barriers for older caregivers because I'm pretty sure in this conference you're going to talk about challenges and barriers and accessibility issues around technology with older adults. But what I want you to finish with is really for you to remember caregivers are under considerable stress as it is. And they're unlikely to adopt and use technology that isn't simple and that they can relate to it. Anything that will add stress is ultimately not going to work. And the goal of technology and apps should be to really make tasks as simple as possible. If not, it's not going to work. So just to summarize, family caregivers need support because of our demographic changes, because things can't keep going the way they're going. There's opportunity to innovate. We have more digital supports, AI, telehealth, caregiver training. We need to be aware of policies that must bridge the gap between cultural expectations and the realities. So if where you live, it's expected that family looks after their own, but the reality is everybody's working and has full-time jobs, that's not going to work. We need to strengthen formal services to support family caregivers. We need to innovate with caregivers, not just for them. We need to partner with others, and together we can transform caregiving. I just want to have acknowledgements that the images that I've used are through Microsoft Bing online images, and that the slides are not to be copied. With that, I say thank you, and I look forward to an opportunity to discuss with you some of the questions that you may have.
Thank you, Adriana, for sharing with us on how to develop an online tool for supporting carer assessment and connecting resources. I believe it is of great reference to our local practitioners. Now we'll accept questions from our online audience. And hello, Adriana now is with us. Yeah, please seize the chance to ask the questions. Hello, Adriana.
Hello. Thank you for having me here. How are you?
Yeah, we are good. Let's take a look at the online audience questions. The first question is about information is the lifeblood of good decision making in care. So what tools can carers and individuals use to get up-to-date information of evidence-based solution that they can use? Yeah, what do you think?
So this is a very important question because there's the internet, and we all know that there's a lot of information that is not really evidence-informed, that is not accurate. Anybody can write anything about anything. And what we're finding, even evidence-based resources, organizations don't keep up necessarily with their websites. So we find sometimes even when we refer people to websites that we know are good quality websites, the information is not up to date. So when you ask where can people get information, it depends where you live, right? And it depends on the type of information you're looking for. Are you looking for educational materials? That's easy. I mean, most Alzheimer's societies in the world have good quality information. I know at Baycrest we have good information. But it's a tricky thing where people get support, because in different countries, support is handled differently, and how the social care and healthcare systems operate work very differently.
I see. So I believe a good consolidated database would be very important. All right, let's look at the second questions we have. So you talk about the cultural background of the carers can be very different, and it may affect how they perceive the caring work. So carers are not homogeneous. How do you handle the complexity to develop the assessment under this condition?
So in Canada, in Toronto, where I live, we have one of the most diverse, culturally diverse groups in all of the world living here. And we always say in Canada, there are 8 million caregivers. And if there are 8 million caregivers, there are 8 million different experiences. And so the way we assess people is it's individualized questions. We need to ask certain questions because different things work for different people. And we can't even generalize. So for example, Southeast Asian families, it's expected that the oldest son looks after the parents, but it's really the oldest son's wife. Having said that, it does not mean that every Southeast Asian family operates that way. So you can't even make assumptions. So when you're doing your assessment, you need to ask these questions of everybody and not make assumptions because it's not just about diversity, it's each individual situation's unique. And so it's important to tailor the resources and the questions to people's personal lives and what they're going through. And I'll give you an example. Even within the same culture, you have different experiences, and you can attest to that. I'm sure you know that the different families do things differently. So it's always making it tailor and specialized to the particular person you're serving, and you need a list of questions without judging. And that's the most important thing for us.
I see. Yeah. So personalized support is very important for carers. All right, let's look at the third question we have. For multi-generational support, young carers are experiencing high pressure. So any insights for support to the young carers? For example, are they more tend to seek help online?
Yeah. So one of the programs we're interested. So when we say young carers, young could mean anything. We generally support 20 to 30-year-olds. We have organizations that support children, Young Carers of Canada, but they don't necessarily specialize in dementia. But they don't want to speak to somebody on the phone. They really want to find information online. They want to chat. Even when we created videos for them for outreach, they're very short, like TikTok kind of ideas. They consume information very differently. So apps are more likely to be used by them. Peer support is more helpful for them. They're more comfortable speaking to somebody their own age. And again, being open to whichever way they can access help, that we can be there for them. But we've found that phone or support groups are not as helpful for younger people.
So the help-seeking behavior is very different among the young population. All right, so let's look at the fourth questions we have. We observe a lot of old care cases in Hong Kong. Anything that we can do to motivate these users to get more immediate support, like some smart home device, would that be helpful?
Absolutely. And it was interesting because I was talking to a colleague of mine today that specializes in technology in the community for older adults, because the problem is one of the provinces in Canada tried giving people for free technological support when they're discharged from the hospital. And people didn't want it, even for free, never mind paying for, because it's overwhelming for them. So the best thing is for them to learn about the technology before there's a crisis. In an ideal world, we should be helping people with technology when things are okay in the community. And then when a crisis happens, somebody falls, breaks a hip, whatever, and they come back home, already everything's in place. Because at times, of crisis, families and older people find it very difficult to adjust to the new technologies. So in an ideal world, it should be done as kind of part of the course. Is kind of, this is preventive. Like people, people get life insurance, people get technology supports put in, hoping that they don't need them. But if they need it, they already know how to use it. So that would be the ideal, we find would be the ideal situation.
I see. Thank you for sharing with us. So now we have one more question also. Most of the time, onset could be sudden and carers are not ready and equipped. Do you think the comprehensive online assessment could be a first step at that time point?
Absolutely. And by comprehensive, I mean, there is something called preparedness to be a caregiver. There's such a construct. And so, which means people that are not ready, that are kind of thrown into it all of a sudden, have to deal with the practicalities of things emotionally, depending on the consequences of something sudden that happened, the guilt, depending what happened. So it's emotional, financial for a lot of people. If you have to stop working, it's important to assess preparedness to be a caregiver. There's a lot of validated assessment tools already out there. I mean, I don't know in what languages. I know they're in English. I assume they're in other languages as well. But it's an important construct to keep in mind, this preparedness to be a caregiver, because those that are better prepared fare better. And if people are not prepared, it's on us to support them through it and to help them navigate the very difficult time that they're going through. But in different countries have different supports. But unfortunately, we don't support necessarily caregivers at the point of crisis because everybody's busy with the patient as opposed to with a family member.
I see. Okay, let's look at the next question. When we are leveraging resources to innovate during development of C-card, anything has to be given up in the process. Could you share with us your experience?
Yeah, so a lot had to be given up in the process. There's me that wants to know a lot of information because I think it'd be more helpful. The more information I can gather from people or the system, the better we can support them. But you have to trade that with something that's usable that caregivers who are overwhelmed are not going to give up. Because if I give a list of 30 questions that I think would be important to know, people are not going to go through to the end. It's just too cumbersome and caregivers don't have time or patience to complete it. So it's constantly this trade between how much information is critical that to lead people to the right resources, as opposed to it'd be nice to know, but in the end, it won't make that much difference for the caregiver. But me as a researcher would be interested. I mean, when I ask, if you do the assessment, you'll see the age is like 17 or 18 to 64. I'm very interested in actually knowing the ages. But then it becomes a question of confidentiality, right? And the more information and precise information that people give you, the more potentially identifiable the person could be. So we also try not to get detailed information, but enough that we can get them to the right resources. And it's constantly balanced between confidentiality, between making it not overwhelming, between getting the right balance of information in a short way. Our next version, where we're using AI, will have an AI chatbot that will hopefully be more user-friendly. So instead of looking like a kind of a questionnaire now the way it is, it will be depending on what people answer, take them through different paths and say, would you be interested in learning more about this? So those that are interested and want to spend more time with it will be able to, and those that just want a quick answer will also be able to do that.
It is never easy to strike a balance between a user-friendly tools, and all the things that you have to consider in the process. All right, our audience is also still interested about the C-card. So can the C-card link to the existing case management system when it is anonymous? Do you keep a database to avoid duplication in data?
No, so through the website, if you do, we don't keep any information because of security reasons and confidentiality. We don't want to take that risk. But if you download the app, then people can save all that information on their phone, right? So because we also have the downloadable apps through iPhone and Google. So then you don't have to duplicate the data because every time you do it, it's all stored on your phone. And then it's not on us as an organization to worry about keeping anybody's data.
Okay, let's look at the next question. For dementia care, the carer's journey is long and unpredictable. How to support the carer as their life may completely change too?
That's the million-dollar question. I mean, how you do it. I think what's important to understand, I mean, people can live with dementia for 20 years or more. And on average, people don't get a diagnosis for the first 5 years, but families are living with this person who's not the same and they don't know what's happening. And depending culturally, whether you feel this is normal part of aging. So what's important to remember is people need different kinds of support at different times of the trajectory of the caregiving. So in the early stages, the diagnostics, people need support sometimes with just anger, disbelief, the practicalities. Do I have to quit my job? Some people are relieved because finally there's an answer to why their person was acting in strange ways. It's very different than as people go through moderate and later stages where they need more physical support, right? I mean, in the earlier stages, you may still be able as a carer just help somebody, but still go on with your life, work, do different things. As the illness progresses, you need to be more there. You may not be able to leave the person alone. They may need, in Canada, we provide support groups, but also hands-on care. People need education to know what's normal for this type of dementia, what to expect. They also need to know about how to look after themselves. And sometimes they need things like to learn how to do medical interventions, right? If somebody needs a catheter, in our system, sometimes it's families doing the catheterizations. So they need practical skills, or how to bathe somebody, or how to look after wound care if they're lying in bed for too long. So it's really throughout the trajectory, caregivers, families need different skill sets and to manage through it. And we also believe that good practice would be when the person finally passes on, bereavement support for people. Because especially for older spouses, that this became their lives, like they were just caregiver and now they're lost, that their whole center, the reason that they, every day what they were doing, they no longer have a kind of structure to their day. Or if somebody's in a nursing home, the nursing home people become their family and friends because they're there all the time. And then the person they cared for passes on and they have no support systems, right? So it's a long journey, different supports at different times of the journey. And again, it needs to be tailored.
That's very true.
One size does not fit all.
Yeah. So again, personalized support is very important at different stage of the carers or the person who need cares. Okay. So one of our audience share views that in this AI and social media era, I don't know why Facebook or Instagram can develop algorithm to narrow down our option in purchase, but we can't develop something that narrow down the option of information for carers based on their online footprint. Do you do something like that?
Well, so that's really interesting. We have the technology to do a lot of things. The problem is that there's just so many permutations. And in Canada, our healthcare system, we have a universal health system. So, but we also have a private system of support. So ethically, it becomes really difficult. We only refer to not-for-profit organizations for support, but there are not that many, and we have long waiting lists, right? So it's problematic in that we could narrow things. We also we're not-for-profits. We don't have the kind of budget that Facebook and Instagram, they have people that just AI experts, they have whole, programs for this. We in hospital-based care that is funded by the government, we don't have the kind of money. Like I have one software engineer and a student to do the technology. We don't have the kind of funding to put on something like Facebook. I don't even know what Facebook's budget for this is. And there's always that tension of the private sector, but the private sector is not necessarily interested in developing something like this because there's no money in it for them unless they use for-profit organizations, right? So I don't know if that translates well to your system, but we just don't have the funding to do the kind of things they do. The technology is there, but we're a hospital, like we do the best we can. But listen, in Ontario alone right now, which is our province, we have a $1 billion deficit in healthcare. And so the money generally goes for professionals and less money is being put into technology, unfortunately, because there's always that competition between we need to pay our staff. And again, I don't know. It would be very different in countries where it's a private medicine kind of the way things are run.
So there is resources concern, and I think the consideration of the whole project is very different, and it's very different as a nonprofit for a nonprofit purpose. Okay, let's look at the next questions. Potential users become frustrated when they encounter a lengthy and complicated procedures to access even after they find the information about it. People sometimes become reluctant to seek help again. So how these issues can be addressed?
So we're struggling with that, and we just had a meeting about it. So listen, any of us get frustrated. We just want one person that we can call, one resource that can meet all our needs. In Canada, it's 211. It's a phone number throughout Canada that lets you speak to somebody or chat online. And you say, my mother fell, she broke her hip, she's in the hospital. They're asking her to come home. I live in Toronto and this part, help me. And there's somebody there navigating you through it, right? 24/7 in over 150 languages. Canadians don't know about this resource. It's free, right? So something like that we find is more helpful than just giving 20 different links. What we're going to do in our next evolution of CCARD through an AI chatbot is help people ask the right questions when they call this 211. Because the problem is people don't realize, like if you go to the doctor and they take a medical history, there's reasons why they ask you what they ask you to get to their diagnosis, right? No different as social workers, we need to ask certain questions to get to the right answers. But sometimes the needs are more complex. It's not that they just need assistance with help at home. Sometimes people need assistance with help at home, and they need education, and they need support. And that's when it becomes overwhelming. And people don't know what they don't know. They would call or go into it thinking, oh, I need somebody to help me in my home, only to realize that they're depressed. They didn't think of, only to realize that there's services there for planning for the future. And so I don't think we're going to be trading in social workers for AI chatbots anytime soon. Because if it were that easy, you don't need trained professionals in this area. You just give resources to people. Because where it's difficult is that the emotional piece of it. It's overwhelming because you're already overwhelmed with guilt, anger, tired as a caregiver. And now on top of it, you have to navigate the system, which is complex. But until you deal with the emotional piece, all these resources are not necessarily helpful for people. Because, for example, with Alzheimer's disease, we have people that can't even say the word Alzheimer's disease. They go the A word, and they're so upset about it. You can't give them education or resources because they haven't even come to terms with the fact that their partner has dementia. They're just so upset. So you need to deal with emotions first before you start giving resources. And that's what's, when we talk about scaling, that's one of the difficulties that I don't think we can give resources, scale, here's a link to this resource, but we can't forget the emotional piece for caregivers. It is hard.
The needs of the carers are actually very diverse. Yeah, we need to deal with different aspects of the needs. All right,
it's overwhelming.
Yeah. And let's look at the next question. The next question is more from a macro perspective. What specific policy recommendations have emerged from your work that could encourage governments or insurers to invest and support digital caregivers tools like C-cards?
I think we don't have a choice. The way we're supporting caregivers now is not working, and the demographics are such that it's growing exponentially. The needs of older adults and what people are able to support. I don't think that digital support is the only way, but it's one of the ways that we can scale things. So I'm not saying let's trade in people, social workers, professionals for technology. But why can't we integrate technology? Governments need to spend the money. It takes infrastructure. It takes, so if somebody's going to stay in their own home and they're at risk for falls, we need to put in technology that detects falls. Right now we have it, but people have to pay out of pocket. It's very expensive for a lot of people. We have technology, people that wander, that exit seeking. People can't necessarily afford it, but we have the technology for it. We have technology about medication management, like dispensing medication for people and supports. Again, who's monitoring this? We had an issue with that, but the pharmaceutical companies don't want to put it in. So the systems, the healthcare system, and then we also need families to be able to help. In an ideal world, like in the UK and Australia, family caregivers are compensated financially for the help that they're doing. So even if you have the best intentions, if you have to work full time, that's a problem. Because even with technology, somebody has to be monitoring this technology. We have apps with systems in the home that tell you that, the toilet is overflowing and this is happening. But could you imagine being at your job? Now you're doing this and you get a beep from your phone. Oh, your mother's water's overflowing. Like you can't, right? And so our different systems need to be working together more closely. Our labor sector, allowing families to be able to work and be caregivers. I mean, that's a whole other topic. Technology is the funding, investing in technology. It is expensive. In the end, it saves dollars. It's more expensive to keep somebody in a nursing home than in the community with the support of technology, yet the money is not there. We know this is better. We know it's cheaper. Somehow, in North America anyway, we're not putting our monies there.
I see. Okay, so no more questions from now. Once again, thank Adriana for your inspiration, and we do look forward to learning more from you in the future. Let's keep in touch.
Very much. Thank you. Thanks for the opportunity, and looking forward to continue the discussion whenever.
Thank you. Thank you so much.
Okay.
The next sharing section by local commentator will be conducted in Cantonese. Please switch language channel if needed. 以下係工作坊6數碼化照顧者風險評估與分析嘅本地評論環節。承接剛才 Adriana 所提出嘅專業分析同科技應用策略，我哋好高興邀請到香港大學社會工作及社會行政學系助理教授盧佩儀教授為我哋作出本地評論。盧教授專研老年課題，擁有社會工作、公共衛生同埋統計學嘅背景。佢運用跨國追蹤調查資料，探討影響老年人健康嘅社會同文化因素，並且評估中美社會政策，例如係長者保護、貧困問題等等。盧教授嘅研究致力於透過政策倡議，促進健康平等同埋社會公義，提升老年人口嘅整體福祉。現在有請盧教授。
大家好，我係佩儀。我啱啱都睇咗 Adriana 嘅精粹報告啦，覺得佢分享來自加拿大嘅經驗非常有啟發性。咁特別佢提到嘅嗰個思卡項目咧，睇得出嚟佢嘅開發係凝聚咗大量嘅思考同埋努力，為我哋香港思考如何通過科技支持照顧者，提供咗好多有意義嘅啟發啦。咁我覺得特別讓我印象深刻嘅一點就係話，佢係如何通過多方合作嚟應用呢啲科技到我哋嘅實際應用中。特別係佢會提到咗我哋來自唔同嘅專業啦，包括老年學啦、臨床嘅醫生啦、社會工作者啦、工程師啦、醫療專業人員啦等多方面都要一齊合作嘅。咁同時咧都強調我哋一定要傾聽長者同埋家庭照顧者嘅聲音。我哋需要問，即係乜嘢係對於佢哋嚟講係有意義嘅，同埋呢啲工具佢哋日常中會唔會真係有用咧？同埋一定要係簡單直接嘅。咁我認為呢種跨領域嘅合作係非常關鍵嘅，因為咧我哋唔單止係用一個工具咧，其實係要最終嘅目的係為咗打造一個真正對使用者有用嘅解決方案。咁所以就需要我哋認真咁傾聽嗰啲使用者嘅經驗啦，了解佢哋面臨嘅挑戰，同時接受嗰個反饋，就不斷咁樣改進同埋提升。同時呢個過程中，我哋都需要用到嗰啲嚴謹嘅方法嚟評估邊啲方法係有效啦，邊啲方法係需要改進啦。咁喺呢個過程中，不斷咁動態地調整同埋優化。咁最終嘅目的其實我哋係希望呢啲工具咧係唔單止係技術上邊係可行啦，喺實際上邊對於長者而言都係非常可以接觸啦，可以使用啦，同埋都係可以日常中係可以非常方便地用嘅。咁我覺得成個報告就 引發咗我哋好多重要嘅思考啦。其實最主要就係話我哋如何應用呢啲科技到老年實踐中啦。最緊要就係如何將呢個科技同埋有深度嘅設計啦、包容性嘅合作一齊放埋一齊。咁接落嚟，我想簡單介紹下我哋香港本地係有邊啲工具係用於照顧長者嘅。咁特別係香港大學同埋我哋嘅合作伙伴一齊開發咗一啲照顧者評估嘅工具啦。咁呢度大家第一面睇到嘅係由香港秀普老年研究中心開發嘅幾套工具啦，主要係由我哋嘅中心總監劉偉群教授主導嘅。咁呢度咧，我哋已經開發咗至少3套工具啦。咁第一套工具就係呢個篩選啦，就係將照顧者嘅風險同埋需求分成唔同嘅層次咁樣。咁第二套工具都係一樣嘅，但係咧我哋類似嘅，不過我哋會考慮咗佢多層次嘅需求咁樣，就會通過佢嘅風險進行分層啦。咁樣就會希望係有利於幫助我哋嘅實踐工作者可以對唔同嘅家庭照顧者進行分層啦，同埋進一步為佢哋提供一啲可以量身定製嘅服務設施。咁除咗我哋強調佢哋呢啲可能有啲壓力風險呢啲比較負面一啲嘅情緒或者情況之外，我哋其實都強調照顧長者其實都係有好多積極嘅層面嘅。咁所以我哋都有一套改編版嘅叫照顧者積極方向面向呢個工具啦。咁所以呢啲工具咧，其實都係喺我哋嘅老年中心嗰個網站係可以供全社會開放使用嘅。咁而近期嚟咧，我哋秀普老年中心係主持咗2個重大嘅項目啦。第一個就係由賽馬會慈善基金會資助嘅叫護老導航呢個項目。咁呢個咧我哋喺全香港地區係至少開咗9間照顧者支援中心啦。咁進入呢個中心，其實我哋都會進行一套嘅評估同埋篩選啦。咁呢個咧都係我哋同加拿大嘅經驗類似咧，我哋係共建呢個模型嘅。咁照顧者入嚟咧，都係有一套嘅評估工具啦。我哋係會將佢哋分成唔同嘅層次啦，包括4個層次低需求啦、中需求啦、中高需求同埋高需求。咁呢個咧係已經係開發完善嘅啦。咁我哋而家係進行緊服務提供嘅階段咁樣。咁第二個項目咧係叫同樣都係由賽馬會慈善基金會資助嘅，叫有伴同盟護老者支援計劃2.0。咁呢個同之前嘅護老導航唔一樣嘅話，就係我哋呢個係提供嘅上門照顧服務。咁所以呢部分嘅服務使用者係有啲唔同嘅，佢哋就可能係出唔到街嘅長者啦，同埋所以佢哋嘅需求係有所唔同嘅，所以我哋嘅工具都因此需要進行調整啦，同埋適應佢哋特殊嘅需求。咁呢套工具咧，目前正在開發中，但係有啲取用嘅程序或者考慮嘅方法都係類似嘅。咁所以我哋進行呢啲評估工具嘅開發，都係經過一系列嘅科學嘅過程啦。特別係從一個研究嘅角度嚟睇，即係話我哋呢個工具係咪有效啦，同埋可信啦。咁其實呢啲都係經過個比較嚴謹嘅評估啦。咁所以大家如果有興趣，都可以參考我哋發過嘅文章咁樣。咁對於嗰個護老導航項目咧，其實我哋係開發咗一個11個項目嘅工具啦，就將照顧者分成唔同嘅需求咁樣。咁除咗香港大學嘅開發嘅工具咧，其實我哋成個香港社會層面都有好多可以使用嘅工具啦。咁 第一個就係嗰個照顧者資訊網啦。正如 Adriana 提到，咁其實資源係好多嘅，咁但係其實照顧者或者長者佢哋可能缺少咗一個信息嘅平台去知道呢啲信息喺邊度咁樣。咁所以其實呢個照顧者資訊網咧係相當於提供一個一站式嘅資訊服務啦。咁呢個網站係24小時運營嘅。咁大家可以見到咧，而家我係一個截圖啦。其實佢係一個有唔同嘅工具啦。咁包括一個網頁版啦，同埋入到去都有個自動嘅嗰個聊天機器人咁樣問你係有咩情況。咁當然我哋除咗呢啲網絡嘅工具，仲有最傳統嘅就係打電話啦。打182、183咁樣可以有專人會接聽電話同呢啲長者或者照顧者匹配佢哋嘅資源。咁現時咧呢個照顧者資訊網同時都開發咗嗰個手機嘅 APP 啦，同埋WhatsApp 嗰個聯繫咁樣，所以嗰個渠道都係進行比較多元化拓展。喺政府層面咧，其實我哋都可能見到有啲長者可能係有啲障礙，係會用到呢啲高科技啦，或者佢哋可能暫時個媒體素養係比較有限。其實香港政府都係做緊一啲努力嘅，包括而家佢哋推行緊嘅呢個叫有知識長者數碼共融計劃啦。為時2年。其實咧係主要向會展計劃啦，就提供呢啲上門教學啦、數碼工具培訓，鼓勵唔同嘅世代進行一齊合作啦。比如講年輕人可以教或者幫助長者使用科技咁樣。所以呢啲都係一個好好嘅試行啦。所以我想總結下啦，從香港嘅經驗嚟睇咧，其實而家我哋都係一直喺度發展緊唔同嘅科技啦。但係最緊要嘅係我哋有一個個思維係如何將呢啲創新嘅科技融入到我哋嘅服務流程。喺呢個過程中咧，跨界合作係好緊要嘅。我哋需要唔同領域嘅人啦，包括老年學者啦、社工、工程師、政策決定者一齊嚟合作啦。要打造我哋呢個工具係真正可以服務於老人嘅。另外一個咧就係我哋都強調我哋一定要係以長者同埋佢哋嘅照顧者為中心啦，所以佢哋嘅聲音一定要俾人聽到，所以我哋一定要聽佢哋講佢哋嘅反饋，根據佢哋嘅反饋不斷咁樣優化我哋個工具。最後咧就係話喺呢個過程中咧，我哋都係需要持續嘅評估啦，同埋一個改進，不斷咁進行調試測試，確保呢個工具係真正好用，同埋服務於長者同埋佢家庭照顧者嘅需求。好我嘅分享就係咁樣。
多謝盧教授嘅分享。而家我哋會接受線上觀眾嘅一啲提問。盧教授你好。係，咁咧我哋睇下觀眾嘅提問先。咁觀眾就問啦，香港咧有好多照顧者 burnout 嘅新聞，點解咁難及早察覺到呢啲個案嘅需要咧？我哋點樣可以加強到多方面嘅協作咧？
係佢呢個需求咧，我覺得可能好多呢啲個案咧係特別高壓力咧，可能喺一個信息嘅繭房入邊，即係佢哋暫時未知道其實外界又係有比較多嘅資源嘅。咁所以正係我哋呢啲唔同嘅機構啦，全香港唔同嘅機構啦，包括政府同埋我哋嘅NGO 都係共同努力，即係希望我哋可以揾到呢啲難以接觸嘅長者，等佢哋知道其實佢哋唔係孤立無援嘅。呢啲都係我哋進行緊嘅努力啦。但係咧，最緊要其實我覺得就唔單止係我哋機構或者政府做啦，其實我哋每一個香港市民啦，其實都要一齊努力嘅，因為咧，我哋係需要發揮呢啲即係嗰啲鄰里互助嘅精神。希望大家知道如果你哋嘅朋友啦、親戚啦、鄰居咧係有呢啲咁嘅壓力，係希望你可以傳遞到呢啲知識。咁所以我覺得其實呢個係需要全社會方方面面進行一個努力，先至可以盡力解決嘅問題。明
白，多謝盧教授。咁咧，下一條問題咧都係同照顧者係有關㗎。咁 咁觀眾就問啦，照顧者嘅壓力咧，好多時都唔知道自己係有咁大壓力嘅，點樣正確提醒佢哋有需要就要去求助咧？
係咁其實咧我覺得咧呢個都係一個動態過程啦，因為咧我哋好多時候都見到係壓力係從細到大，從淺到深，咁所以咧其實應該係盡早有一啲壓力嘅苗頭咧，就應該盡力去鼓勵佢哋去出去求助啦。咁所以提供個信息都係好緊要嘅。咁當然我哋個態度都係好緊要咧，因為你講到係正確啊嘛。我哋都係需要話，我哋個態度係如何等佢哋鼓勵啦，同埋鼓勵或者如何等佢哋揾到一個啱佢哋嗰個資源啦。咁所以呢個講嘅方式都係要適合佢哋嘅。比如講我哋講嘅呢個照顧者資訊網啦，其實佢有唔同嘅途徑嘅。所以我哋就其實可以同長者啦或者照顧者一齊討論邊個方式係啱佢嘅。比如講，如果佢中意淨係瀏覽網頁啦，或者佢淨係中意同機器人聊天啦，或者佢想打電話會更方便嘅話，其實唔同嘅方式都可以達到嘅。最緊要就係話，我哋需要諗到係邊種方式係啱呢個長者同埋佢嘅屋企人咁樣。
明白。所以資訊同資源嘅提供其實都係好重要嘅。咁咧，我哋睇下下一條嘅問題啦。觀眾就問到啦，喺照顧者評估方面咧，一啲線上嘅評估同面對面進行嘅評估有冇啲唔同嘅地方咧？
係。呢個都係一個好有意思嘅問題嚟嘅。咁當然我哋覺得面對面係應該係雖然咧佢係有啲成本啦或者時間嘅考慮啦，但係咧確實我覺得人同人嘅面接觸咧係確實係一個最真誠啦，同埋因為你唔單止通過嗰個語言啊，都可以通過肢體語言啊、環境啊、其他嗰啲即係非對談以外嘅地方都可以觀察到一啲額外嘅信息嘅。咁所以佢係有優勢嘅，係。咁但係咧，有時候我哋都知道佢有啲限制咧，比如講成本啦、地點啦、時間啦呢啲考慮咁樣。咁面對面啦，當然都有佢嘅優勢啦，就係佢就慳時間啦、成本低啦，同埋會比較快速咁樣。咁當然與之相對，佢嘅劣勢都會明顯啦，即係話你除咗面對面咁樣見到佢嘅面部表情啊或者語言，其他以外嘅嘢咧，可能就會比較難有機會接觸到咁樣。咁所以我覺得唔同嘅之處在於就話有啲額外嘅信息可能係佢哋有啲係面對面係先收集到，咁但係咧我哋喺選擇唔同嘅取訪啊或者收集信息嘅時候咧，其實係要考慮到唔同嘅情況咯。即係如果比如講長者或者家庭照顧者佢更願意用面對面採訪啊，或者線上嘅話，其實我哋都要因應佢哋嘅需求嚟選擇更合適嘅方法，係啦。
明白，多謝盧教授嘅回應。咁咧，我哋答問嘅環節咧嚟到呢度先，再次多謝你嘅分享，再見。
好，唔該晒，拜拜。